Hi, everyone. I'm here with Dr. Robert Floyd. Thanks for being here, Doc.
Awesome. Thanks for having me, Steve. This is super fun. Enjoy doing this a lot.
Yeah, it is. It's like we kind of trigger each other and get us thinking about different things. So, I heard, all these different things, GLP-1s and, you know, semaglutide, tirzepatide, which I am not a fan of. Retatrutide, I absolutely am. That goes through 3 different pathways. But that's not really the point of what I wanted to talk about here. Because you said something last time we talked about getting the basics right, get your diet right, eat whole foods. What should your macros be? My macros have changed from the time I was 22 until 63. Now, my macros are completely different. The way I eat is completely different. The way I exercise is different. I've always been a pretty good sleeper, so that's good. I sleep well. But all these tools, which we'll call peptides, that help do these certain things, it's the result that we're after. But how are we getting that result? Is it really the peptide? Now, peptides are powerful and they're awesome tools to help you get to where you want to get. But I'll just throw it out this way. If, let's say, retatrutide helps you lose 70 pounds, or it helps you lose 100 pounds, which is, they call it GLP-3. And it is amazing. So let's say you lose 70, 100 pounds. Now they can say that retatrutide did this, and this. But did it really? What? So I want you to tell us, Doc, what happens or what can happen to someone's health if they go from 280, a male, let's say, goes from 280 down to 185. Tell me all the things that can happen to your health. If you go from 280 down to 185, what's going to happen to your health and what gets credit for that?
Yeah, it's a good point. It's a good question. Again, I'm not a super huge fan of, Wegovy or semaglutide, Ozempic. But the end point is what we're all after, right? You're talking about losing weight, losing 100 pounds. Excuse me. What most people don't know, and this whole body positivity movement that occurred about 5, 6, 7 years ago without, being fat's okay. Let me tell you, being fat is not okay.
And nobody
It
wants to
is,
be fat either, by the way.
I agree with you. A lot of people say, "Oh, I'm okay with it." Well, deep down, they're not. It's a shameful thing sometimes, and people just don't. I'm not fat shaming at all. I'm As a doctor, it is my job to say being overweight is detrimental to your health and your long-term longevity. What a lot of people do not know is that being obese is directly related to 16 different types of cancer: colon cancer, breast cancer, stomach cancer, lung, or colon cancer, 16 different types of cancer, right? Especially female cancer, ovarian cancer, uterine cancer, because fat cells are very, very inflammatory, and fat cells also release and they increase the estrogen in your body. Okay. So as a male, you don't want a bunch of estrogen. Okay. There's been linkage to estrogen, excess estrogen leading to cancers. Again, being obese is directly related to 16 different types of cancer. That's the number one thing. You have these fat cells, they release their adipokines. That's from adipocytes, are the fat cells. Those are super, super inflammatory, right? And so also, that's just the first thing right there. The second thing is that when you are 100 pounds overweight, you really have no reserves. Again, like I said, I did 2 years of trauma surgery as a resident down in Las Vegas. I learned a ton of critical care medicine. And when I say that if you're really morbidly obese, you have no reserves. Imagine you have twins, right? One is 200 pounds and one is 125 pounds. Let's say females, right? They both get in the same car wreck, have the same injuries, and they both get sent into the ICU and they're on a ventilator. The one who is overweight is going to be on that ventilator sometimes up to 50% longer because it takes so much more energy for your body to maintain homeostasis when you're overweight. One of the things is that just being overweight itself, it requires more energy. It requires more energy to maintain homeostasis. And your body the whole time is trying to lose that weight. Your body knows what it wants to be. Again, the human body's genius. It knows that it doesn't want to be 400 pounds. Okay. So you asked about like, so what is the was it the GLP-1 or the Reta that decreases inflammation, decreases diabetes, decreases high blood pressure, increases cognition? No, it's actually the loss of the weight. And I mean, we can talk about how that helps everything.
What about heart disease? You lose 85 pounds. How's that improve your heart condition?
Yeah, again, it's, you're decreasing the inflammation. Adipocytes, the fat cells, are very inflammatory, right? I am not a huge fan of the fat cholesterol heart disease myth at all. There's people out there walking around with cholesterols of, 300 who don't have heart disease. They have a totally clear coronary calcium score. What I am a what I believe is the cause of heart disease is inflamed cholesterol or inflamed lining of the blood vessels, inflamed endothelium, which is the lining of the blood vessels. Inflammation is the killer. Okay. It's not
But how does
cholesterol.
that change with 85 pounds of fat lost?
Like I said, adipocytes are super inflammatory. So when you lose 85 pounds of fat, your inflammation markers markedly reduce, right? So your body is not struggling. Like when you have all this excess fat, your lungs have to work harder, your kidneys have to work harder, your heart has to pump harder. And all of that together, we only have a certain amount of life, right? There's in Chinese medicine, they believe that your kidneys only have a specific amount of filtering that they can do in your whole life. And they also believe that you are born with a very specific number of heartbeats that you get.
Yeah, that's why I don't do cardio.
I don't do cardio either. I think cardio is
I
bullshit,
don't wanna
man.
waste my heartbeats.
I really don't do cardio. I think I do cardio by doing jujitsu. I mean, trust me, that's cardio. That's right. But so when you are losing fat, also again, it decreases inflammation, it improves insulin sensitivity, right? As you get overweight, you have insulin resistance. Insulin resistance, again, that combined with inflammation, those two are absolute killers, right? Metabolic syndrome is insulin resistance, it's dyslipidemia, it's high blood pressure. There's 5 markers of metabolic syndrome. If you have 3 out of those 5, you have metabolic syndrome. If you have metabolic syndrome, and that you are at a 50% increased risk of dying just by having metabolic syndrome. Again, it's insulin resistance, it's dyslipidemia, uh, triglycerides, high HDL. It's a waist circumference greater than the normal. Like in men, it's 42 inches or 40 inches, and in women, it's 32 inches. I can't remember exactly the specific numbers. And then, and high blood pressure, right? So when you have this obesity, you basically have what's called metabolic syndrome, right? And again, if you have metabolic syndrome, you are at a 50% increased risk of dying from likely a cardiovascular event. So when you can decrease that obesity, you are going to decrease the signs of metabolic syndrome. You're going to increase your insulin sensitivity. You're going to increase your hormone levels. They're going to balance out. Again, the body is genius. It knows where your hormone levels need to be, right? And another thing that a lot of people don't understand about being obese is that those fat cells, they're deposits for toxins, right?
Yeah.
So that's where a lot of toxins get stored. So in those fat cells, it's a great place to store toxins. And so when you lose those, you are also detoxing yourself.
And people feel horrible. A lot of people, they start to lose that body fat, they feel horrible. Why? Because all those toxins are coming out into their system all at once, and it overwhelms the body.
Exactly, exactly. So again, the question was, is it the Reddit or is it the weight loss? I'm going to say it's the weight loss. And if it takes the Retta or the Ozempic to get there, I'm trying to be less black and white and trying to be more gray. Like if you need Ozempic or Retta, again, I'm not a big fan of Ozempic, but if you need it to kickstart you to lose weight, losing weight is going to be the number one predictor of you living longer.
Yeah, you know what? And I won't do this, but I could have you here for a whole nother week telling me and telling us, okay, what happens when you reverse fatty liver, which you can do? What happens when you reverse diabetes, when you reverse insulin resistance? So again, is it the Retta, which I'm a huge fan of because it does help this. It's a powerful tool, but they're studying it now for, I've heard they're studying it now for sleep apnea. Yeah, it fixes things when you lose 100 pounds. But I would
Absolutely.
have you here for another week talking about, okay, what happens when you reverse diabetes? What happens when you reverse a fatty liver? Now you're going to go on and on and on about more and more health benefits of the downstream effect of the weight loss.
Absolutely. And you talked about, sleep apnea. Sleep apnea is terrible for you. It is definitely leads to an increased risk of AFib and sudden cardiac death. AFib is when your heart is fibrillating. Your heart's supposed to go boom, 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 right? And the atria in your heart, your heart's in four different chambers, the atria at the top, and it'll do this. It's fibrillating instead of squeezing like it's supposed to. It's supposed to do like this, right? Rhythmically. Atrial fib, it doesn't squeeze like it's supposed to. And that increases your risk of stroke and sudden cardiac death. So when you lose that weight and you get rid of the sleep apnea, that right there is one way to improve your longevity. Another thing you mentioned about joint pains, right? You said they're doing research on Retta for decreased joint pains, decreased arthritis. Yeah, when you lose 100 pounds, guess what? Your hips and your knees don't hurt anymore, right?
Right.
So that's one of the things I've seen. Some people who are overweight will go to the orthopedic surgeon. And if he's a good orthopedic surgeon, he'll say, I'd like you to try to lose 50 pounds first before I do total knee, right? Because that excess weight is not good on your joints. So, yeah, we could go on and on and on about weight loss. And, we should do another podcast talking about, I call it, I've coined the term time optimized eating instead of intermittent fasting because I'm a big fan of time optimized eating. And that we can, let's do another podcast about that in another time because I love it. It's actually the best biohack in the world and it's totally free.
Absolutely. Yeah, I'm a big fan too. But as I've gotten leaner, I'm about 12% body fat now, maybe a little over. But my macros have changed. I need to eat more carbohydrates, but I still have the same eating window. So anyway, Doc, yeah, that is a good topic. So if people want to know more about you, how do they get a hold of you? How do they follow you on social media?
That is Empowerment MD, EMPOWERMENT MD. That's on Instagram and Facebook, as well as empowermentmd.com is my website. And then also on TikTok, it's Robert Floyd MD.
All right. Appreciate it, Doc. Thanks for being with us.
Awesome. Thank you, man. Can't wait to come back.